on direct link between the breast cancer and the gene. I was asked a little bit about the breast cancer gene, and can you tell me more? So the BRCA1 or 2 gene is a mutation in this gene that is responsible for controlling cell proliferation or cell growth. And so an individual who carries the BRCA1 or 2 gene mutation does have a higher risk of breast cancer, which is 40 to 80% lifetime risk. Ovarian cancer, 20 to 40% lifetime risk. That's pretty significant. And colon cancer is also another risk cancer in that BRCA mutation, as well as prostate and pancreatic cancer and melanoma. So when we look at cancers, again, coming back to the family history, I try and identify who's had cancer, what kind of cancer, and the age. And if I identify there's a significant pattern of cancers in this family, I refer them to my genetic counselor. And the genetic counselor has the time to build a pedigree, and they look and see with documented histories, because a lot of people say, well, I think they had this kind of pelvic cancer. And I said, was it the ovary? I don't know. Well, that's a really, I don't know, because we really need to know, was it ovarian or was it uterine cancer? Because those are important facts that the counselor then decides this is a family where there is a greater than 10% chance of carrying a mutation or being at a hereditary risk. And then they talk to you about should you test or not test for the mutation. That test costs $3,000 to $4,000. And it's a blood test that takes about 3 weeks. It's sent to a lab right now. There's one place in the country that does it called Myriad Genetics. And when that result comes back, they tell you you carry the mutation or not. If you carry it, that's when you then go to your doctor to discuss what are the options to prevent the cancer. Take the breast, take the ovaries, take a medication, or high intense surveillance. So this is the BRCA connection, is really understanding, again, the family history details, and then having a genetic counselor tell us this is a family that has enough risk to test for the mutation.